Around the globe, many people struggle to get access to the cancer care they need. Unfortunately, who you are and where you live determines the level of quality care you can access. This needs to change. On this World Cancer Day, February 4th, we join with UICC in calling for the cancer care gap to be closed. And to achieve this, it requires all of us to participate and do our part in getting this access for patients. At Roche, we work with governments, healthcare authorities, global organizations, civil society, academia, and patient organizations to build partnerships that can finally close the cancer care gap. So let's take a look around the globe for some inspiring examples of how we're working in partnership to close the cancer care gap.
Philippines has a myriad of health issues, exacerbated by a population of close to 120 million, distributed throughout over 7,000 islands, which, together with economic and access disparities, challenges the ability of the population to access timely, life-saving healthcare. Cervical cancer is one of these health issues. Approximately 11 women die every day of the disease, a disease that can be both prevented and eliminated. Roche is joining the efforts of the government and NGOs to eliminate the disease in the Philippines by partnering with GPEGO in a project to introduce simplified, scalable HPV DNA testing with self-collection sampling, and to enhance the awareness of cervical cancer prevention. Together with our partners, we're building an ecosystem to help close the cervical cancer prevention and care gap in the Philippines.
Here in Indonesia, strengthening cancer care and the overall patient journey is a high priority. Together with distinguished partner of Darmais National Cancer Center, Indonesian Oncology Nurse Association, and University of Indonesia, we co-created programs for nurses to enhance patient and system outcome by increasing oncology nurse specialist training programs. Our vision is to continue collaborating to train and educate the workforce, as we have seen firsthand how partnership can close the cancer care gap.
One of the main barriers to access to cancer care here in Nigeria was the insurance model. Despite being a large country, less than 10% of the population had insurance. This resulted in many people actively avoiding medical intervention in an attempt to avoid the associated personal cost. By the time they chose to receive medical intervention, it was frequently too late. Identifying this barrier, Roche engaged with the National Health Insurance Authority and a range of policymakers to enter a memorandum of understanding to change the insurance model, meaning increased access for Nigerians to oncology treatment. At Roche, we will continue to challenge the status quo and form partnerships that create sustainable financing for cancer care across communities, organizations, and government.
Recently, we signed the managed entry agreement with the Ministry of Health of Georgia within the Universal Health Oncology program, ensuring the full coverage of the treatment of oncology patients in the country. Georgian example is a great example how partnership and collaboration can make a difference for patient life, enabling them to receive the proper treatment they need, despite the economic status or despite the insurance status.
We know there are many challenges in ensuring that people everywhere are able to access the cancer care they need, but we join with UICC in the call to action to close the cancer care gap. Together, we can close the cancer care gap, making a real difference to patients, health systems, and societies.